What's going on, everybody? Welcome to the channel. Thanks for tuning in today. Now, I know it's been a long time since I did a video. It's been a good little while, but nonetheless, I'm back, and I'm back with some new information and possibly a new procedure that I'm going to be doing. So, of course, as always, I'm going to take you guys through this step by step. Now, first, I wanted to do kind of this pre-video to kind of give a little bit more information and kind of start this little series that I'm going to start doing off with this new procedure that I might be doing. So, this is totally new to me. I've never done it. I've never even heard of it. This is all new. Like, this is literally something that's happened like the last month. So I'm going to give you guys the definition of this procedure and what it entails, and then try to just talk my way through it and answer some questions and just see what the internet says about it, and then also give you guys some insight to what people have said about it that I've asked. So let's start off with what this is. So this is going to be a nerve ablation procedure. Now, I don't think they count it as a surgery because they don't put you under for it, but this is a nerve ablation. Now, the nerve ablation is a method that they basically take your problem area of your nerve damage area, and they either cryo freeze it, or they can actually go and cut it out, or I think they kind of just inject some stuff to kind of kill that nerve off. Now, I'm going to read the actual definition, but that's pretty much my interpretation of it or my take on it. So I'm just going to read the definition, and then we'll get back into it. So it says the destruction, also called ablation of nerves, is a method that can be used to reduce certain kinds of chronic pain by preventing transmission of pain signals. It is a safe procedure in which a portion of your nerve tissue is destroyed or removed to cause an interruption in pain signals and reduce pain in that area. Okay, that is like the medical definition of it. And basically what they do is, I guess they put you through some kind of test, and I will be showing this hopefully in future videos, but they put you through a test to see where your problem area is, you know, where exactly is that pain area. And then when they pinpoint that area, they either go in with some needles, like some crazy looking needles, as you can see behind me. I'm gonna put the picture's gonna be behind me, but they put some needles in you to the problem area of those nerves, and then they either cryo freeze it or they do radioactive. And I think there's one more method, but I'm not sure what the third method is. But I know the first two are cryo freezing is one way that they get rid of it, and the other is radioactive. So I'm not sure which at this point is more effective, or if they try all three different methods, or, you know, to see if it actually, because maybe one works and one might not, or what actually is maybe stronger than the other. I mean, who knows? I really don't know if one's stronger than the other. I will find out all the information in the future when I start doing more videos on it. But as far as today, we're just kind of going to do kind of a talk through, or just a kind of cursor to what is to come. And I think my appointment is next week. So next week I will be releasing another video of my doctor visit. Hopefully if they let me film it, and just get questions on it. And if you guys have any questions that you want me to ask, write the questions in the comments below, and I'll ask them if you're new to this or if you're interested in this. Now, this is something that you would be interested in, of course, if you're new to the channel, or if you are an existing subscriber or watcher. You know that so my accident left me with my right leg pretty damaged, pretty weak, and a lot of nerve damage. And if you're new to nerve damage, basically what my right leg feels like is, if you ever hit your funny bone in your elbow, that numbness and tingling feeling is pretty much what I feel all day. So as you can imagine, or if you are a person who lives that reality, that is a really hard pain to live with. I mean, taking pain pills and having to, you know, meditate and having to really live with this type of issue is, you know, it's hard, and it's a pretty big deal, and it's really difficult to do. I don't think most people are even built to go through that, but, you know, who knows? So basically, I want to try this procedure out because I've never heard of it, and I'm really interested to see if it works. Now, from the groups that I'm in, I've heard kind of 50-50 mixed kind of reviews. I've asked people, and some people have said, hey, it worked great for me. I have no more pain. I go maybe once a year to, you know, re-up on it, because I think maybe sometimes it might wear off, just, you know, depending on everybody's body is different. So depending on, you know, your body, you might be able to go once and never have pain again, but you might have to go back every 6 months, every year. It really, I guess, just depends on the person and your, you know, how severe your issue is. Now, me, I think I probably got the worst case of nerve damage ever. I would love to like compare my nerve damage to other people's just to see where I fall on the scale, because I have nerve damage like you wouldn't believe. But and pain, neuropathy pain is it sucks to live with. But so this is going to be something interesting to check out. Now, I was reading about it. I mean, at this point, I've only read about it and asked a few people. And, it's kind of 50-50 reviews on it. Some people say it worked great. Some people say, it really didn't work. So you just got to, try it and see where you fall in that whole, scenario. So I'm just going to read what I find, basically. So this is a question, is nerve ablation painful? So it says patients may experience pain from the procedure up to 14 days. But this is generally due to residual effects of the nerve ablation or muscle spasms. Patients are often up and around back to work within 24 to 72 hours after the procedure. So it doesn't seem like it might be, too bad. You might have some irritation, some pain, depending on what kind of person you are, what kind of underlying issue. So everybody's different once again. How is a nerve ablation done? Radiofrequency uses heat generated by radio waves to target specific nerves and temporarily turn off their ability to send pain signals. The procedure is also known as radiofrequency ablation. Needles inserted through your skin near the painful area delivered the radio waves to the targeted nerves. So that sounds pretty, interesting. I'm very interested to see it, since they don't put you under, how, maybe they just numb you up and, stick you with some needles. I don't like needles, so they're going to have to numb me up with something because I can't watch it. I'll freak out. But I'm sure they have some kind of, whole procedure for people like me who don't like looking at needles. I'm not a needle person. Is nerve ablation considered surgery? While the procedure is safe and non-surgical, treatments will lower risk for complications than sometimes do happen. Complications from radiofrequency ablation can include infection, numbness, allergic reaction to the medication, or contrast dye that may be used during the procedure. I don't like contrast dye. I've had to drink that stuff before. Oh, it's terrible. I think that was contrast dye. Whatever that milk crap is that when they x-ray you, it tastes so bad. How long does it take for radiofrequency ablation? How long does it take for you to get over? Full pain relief can be expected within 2 to 3 weeks. So 2 to 3 weeks after, you should be experiencing, less pain. After the procedure, since it can take some time for the ablation nerve to die and stop sending pain signals, it is possible that you may feel uncharacteristically weak in the back, neck, and during the time, which will fade as you recover. So you might, need some time to recover. You might be weak. Let's see, what else is there? Are you awake for this nerve ablation? Your catheter ablation procedure will be done by an electrophysolid. I don't even know what that says. I'm not even going to try. It just says you will be hooked up to a delivery medication fluid. You will receive medication for either conscious sedation, which puts you in a fog, or general anesthesia. Okay, so they don't put you to sleep. Well, they kind of put you to sleep, I guess, if you fall asleep. But they put you under anesthesia and stuff, so that's good. Some of these words are like words I've never seen, so I'm not even going to try to demolish them. It's not going to happen. How successful is nerve ablation? Many have found radiofrequency nerve ablation to be 70 to 80% effective for those who have had successful nerve blocks. Patients will experience pain relief as soon as 10 days after treatment, and it can last anywhere from 9 months to 2 years. So, okay, that's cool. Okay, so based off of this information that I've read on here, 9 months to 2 years. So it seems like something you might have to do if you're lucky, every couple years. You might have to do it. I mean, small price to pay for, living with, pain-free nerve damage. Because let me tell you, it's nothing you want. How long do you stay in the hospital after the nerve ablation? You may stay in the hospital overnight after your nerve ablation so the doctor can and nurses can keep an eye on you while you recover. You may need to rest in bed about 6 to 8 hours after the ablation. Some people leave the hospital the same day. Most people leave the hospital the next morning. I hope I don't have to go to the hospital to do this. I do not want to go to a hospital. What What can grow with radio frequency? Oh, what can go wrong? I'm tripping. What can go wrong with the radio frequency ablation? Damage to surrounding blood vessels, nerves damage, needles insertion, resulting in excessive bleeding, damage causing long-term numbness and tingling. Well, that's not great. Heat damage to structure adjacent to the targeted area. So, of course, there are some risks, but there's risk with everything. But does nerve ablation have sciatica? I don't even know what that. Oh, does it help sciatica? Okay, I can't really read that great, but okay. Does nerve ablation help sciatica? That's a good question. Let's see. A minimal invasive procedure in which pulses of energy from a probe are applied directly to the nerve root near the spinal is a safe and effective in people with acute lower back pain that has not responded to conservative treatment according to the new study. Oh, okay, that's interesting. What happens if the nerve ablation doesn't work? That's a good question. It says repeat the procedure. In some cases, nerve targeted, and the procedure may grow back. Okay, so the nerves can go back. The nerves can grow back. Can't say grow back. So your pain will return if the radio frequency ablation relieved your pain temporarily, but then returned after a few months. It may be beneficial to repeat. Okay. So yeah, it's either hit or miss or a lot of repeat. Hit or miss or repeat. How long does it take for the nerve to die after ablation? It can take up to 3 weeks to have no more pains transmitted. Okay. All right. So that's pretty much, that's a lot. I mean, they literally have a lot of questions on here. It's actually pretty cool. So I'm going to stop right there. So basically, this procedure is going to be interesting. I'm going to try to write down a bunch of questions to ask because the day of, I'm probably going to forget everything. But I'm going to write down a bunch of questions to ask. And let me know in the comments down below if you've had this done or if you want to do it and, you're thinking of it. I'm going to try my best to really film this whole process going forward. So next week I should be dropping another video for you guys. After my doctor visit, I'm going to try to film as much as I can in there, but sometimes they're a little funky about filming and stuff, but I'm going to try to at least, worst case scenario, I'm going to try to get the audio, for you guys so I can, upload it for you guys so you guys can really get the experience of what it's like to go through this whole process. So that's basically my video for today, guys. This is something new that I'm going to be doing as far as procedure wise. So, and I will be dropping more videos in the future. And I think my 1 year from my tendon transfer surgery has, I think it comes up in November, and that'll be 1 year since I've had that. So I'll let you guys know in the next video how that's going basically. So, and just what the benefits of that was, and how I'm doing now and how did it help, and just all that good stuff. So that's gonna be my next video. So that's it for today, guys. Hope you guys really enjoyed this video. Like, comment, subscribe, share. Go to the Instagram. I have all my clips on there. Support the channel, please, so I can do a lot more of these videos. I was gone for a while, but I'm back doing a lot more videos for you guys. So have a good day. That's all. Peace.